Hi Lucy, nice to meet you.
Hi.
So I understand that you were referred here by your GP because you've been feeling quite down recently.
Yeah, I thought I've been feeling quite bad for quite a while, so I thought maybe it's time to see someone about it because I don't want to feel like this anymore.
Counseling psychology is a type of professional psychology that focuses on general practice and providing health services. It examines how people of all ages function both personally and in their relationships. Counseling psychology is concerned with people's emotional, social, job, school, and physical health difficulties at various phases of their lives, concentrating on common daily difficulties as well as more serious challenges with which people may suffer as individuals, families, communities, and organizations. Counseling psychologists assist people with physical, emotional, and mental health problems in enhancing their sense of well-being, reducing distress, and resolving crises. More severe psychological symptoms are also assessed, diagnosed, and treated by them.
Do you have what it takes to be an effective counselor or mental health advocate? Well, you must at least possess these qualities. First, you need to be very patient. Proceed to the next step of explanation only when the client has clearly understood the content of the information you are giving. Thus, you need to have ample time for the client. Next, you need to be a good listener. Never interrupt what the client has to say. Give your inputs only when the client has finished talking. Next, you need to be very observant and able to interpret nonverbal cues. For example, if the client looks angry, find out the cause of his or her anger first. Next, provide non-possessive warmth in a counseling environment. Smile and show concern and acceptance to the client. Next, you should have good knowledge on the problem. For example, compliance to medication. Some people do not take medication for one reason or the other, while others demand drugs and medication. For instance, Muslims do not take oral medication when they are fasting, while Jehovah's Witnesses do not take blood transfusion. Understanding the factors why people may not do certain activities at a specific time will assist you to assist them better. Next, having empathy with the client. Try to understand the feelings the client is having in the counseling process. In other words, put yourself in his or her position. Next, maintaining a therapeutic relationship with the client. Give the client the opportunity to make his or her own decision from your message.
Now that we've discussed the qualities of a counselor or mental health advocate, let's delve into knowing how does these professionals exhibits one of the most important part of their work, building the rapport and trust of the clients. These aspects refer to the counseling setting, which in initial meetings can cause a significant impact in the client's perception towards the counselor. In a nutshell, the counselor should observe the following. Number 1. Comfort. A comfortable setting improves client expression of feelings. 2 is the security or privacy, providing the clients with security during a session. The noise control, ensuring the noise does not affect communication. The stimuli control, a neutral environment. Supportive environment, a space in which the client can share in their own pace. And facilities, amenities, decor, and other office facilities are relevant aspects to be observed. Counselors first build trust by connecting with clients, demonstrating a desire to understand their perspective and persevering with empathy and active listening. Prior to engaging in interpersonal communication process, there are basic requirements which will influence the client's ability to express him or herself and to make decisions regarding their relationship.
Now let's move on into discussing how counselors identify the problems of their clients. Here are the steps in identifying a client's problem. First, understanding the problem. The therapist tries to understand the full implications of the distress being experienced by the client. It is done during the first few sessions of establishing therapeutic relationship. Second, identification of the areas to be targeted for treatment in psychotherapy. The theoretical formulation clearly identifies the areas to be targeted for a therapy. Thus, if a client seeks help for inability to hold job and inability to face superiors, the clinical formulation in behavior therapy would state it is a lack of assertiveness and anxiety. The target areas have been identified as inability to assert oneself and heightened anxiety. Third, choice of techniques for treatment. The choice of techniques of treatments depends on the therapeutic system in which the therapist has been trained. However, even in this broad domain, the choice of techniques, timing of the techniques, and expectations of outcome of the therapy depend upon the clinical formulation.
Deepening the understanding of a counselor is very crucial in the treatment of the client. It activates the counselor's prior knowledge and sympathy towards the client. Aside from deepening the counselor's understanding, another pivotal role of a counselor to the treatment process is the setting of goal. The 5 most common goals of counseling include: Number 1. Facilitating behavioral change. Number 2. Helping improve the client's ability to both establish and maintain relationships. Number 3. Helping enhance the client's effectiveness and their ability to cope. Number 4. Helping promote the decision-making process while facilitating client potential. And number 5. The development. These goals are guidelines when it comes to helping clients to make positive changes. A big part of the counseling process involves enhancing the client's ability to cope.
Now that we are through on discussing how counselors deepen their understanding and set their goals, now let's move on into the interventions they used. Every person is different when it comes to treatment, and no two plans may look alike. There are several factors at work when determining the type of therapeutic modality that should be used with the patient, including what type of mental health disorder they are struggling with, the patient's own treatment goals, and whether they are also grappling with a co-occurring substance abuse or eating disorder, among other things. Counseling's goal is a whole person healing. It goes below the surface of a presenting problem to determine what is at the root of it, and address that cause so that it doesn't manifest itself in other ways. Some interventions are as follows. Behavioral interventions. The goal with this intervention is to strengthen positive behaviors while at the same time reducing the frequency and intensity of behaviors that aren't beneficial. Affective interventions. Unlike behavioral interventions that address a patient's actions, these kinds of interventions focus on a patient's feelings. With effective interventions, patients who grapple with overly strong feelings can identify and express those emotions properly and learn how to manage them. Cognitive interventions. This type of psychological intervention is geared toward those people who are too caught up in their own thoughts, specifically negative or erroneous ones. Troublesome thought patterns can dictate a person's actions and how they live their lives, and therefore take away a person's own agency.
Now, let's discuss termination in counseling. All that is good must come to an end. The counseling process is one that is deep and requires personal investment. If it has gone well, then there will be a significant personal growth and the next step will come easy. If there is something occurring that is impeding personal growth, then the next step will be difficult. But regardless of the good or the bad, the end is inevitable. Termination is the final stage of counseling and marks the close of the relationship. Termination is the counselor and the client ending the therapeutic alliance. The termination stage can be important as the initial stage is the last interaction many clients will have with the counselor. If the termination leaves a sour note, then the client may look back on the time as a waste of effort and resources. If the termination goes well, then this has a multiplying effect. as the former client sees their time was well spent, and this will be one more person who is helping reduce the stigma of mental health. With termination, there may be some safety features put into place. Many counselors feel that the need to check in their client and after some time, or have their client check in with them. This is commonly referred to as a follow-up and involves communicating with the client to ensure stability and well-being. It's no different than a doctor's office calling in and checking up on you.
A career in counseling gives licensed professionals the opportunity to help those who are coping with loss, depression, anxiety, addiction, relationship issues, and other everyday mental health struggles. In order to be an effective counselor, there are many characteristics that one must possess. An effective counselor must possess a flexible attitude and unconditional positive regard to ensure your clients feel safe and understood, which in turn becomes beneficial for the development of the therapeutic alliance.
So maybe some of you are interested in pursuing this kind of career. Here are more reasons to become a counselor. Number 1. You enjoy helping people solve their problems. To be a counselor, you need to have a strong desire to help people improve their lives. As a counselor, you will have the opportunity to provide an emotional need and empower your clients to make positive life changes. Number 2. You want purpose and fulfillment in your career. If you are someone who wants to feel a sense of purpose at the end of each day, then counseling may be your calling. Helping people reach their full potential, aiding them in their progress each session, and watching them work toward their goals can give you a sense of accomplishment. Every day you will go to work knowing that you're helping others, changing lives, and making a difference. Number 3. You cherish meeting new people. Counselors have the opportunity to meet and work with people from all walks of life. Consider counseling as a career field if you are someone who can honestly try to understand your clients no matter their race, region, ethnicity, or socioeconomic status. And the last one, you are a good listener. People who become counselors often find that they had a natural ability and desire to empathize with other people even before they become a professional. Having the ability to listen carefully without judgment to people's hopes and fear is a necessary skill a counselor needs. However, your natural talent can be honed and trained through academic courses that will teach you what to say and when to say it.